Hello everyone, I'm Dr. Salvador Medina. I'm talking to you from my office in Tijuana. We're going to be talking a little bit about facelifts.
Doctor, can you tell us who is a good candidate for facelifts?
It depends. Usually patients in their probably mid and late 40s are patients that start to inquire and seek about facelifts, because that's when you can see how the skin and the support mechanisms of the face start to get a little bit more loosened, and we can do certain adjustments to have a more natural and rejuvenated face with a facelift. So it's usually patients over 40. There's some patients that sometimes under 40 they seek about this surgery. It's not that common. It's usually patients in their mid and late 40s.
And tell us about the different facelifts. Is there just one, or is there a mid facelift?
There are different techniques, and we have to see what each patient needs. I always combine the mid face, which is the cheek, jawline, and the neck lift. The eyelids, we always have the opportunity to do the eyelids with the facelifts, but we combine always the mid face and the neck for the facelifts.
Are patients able to do a nose job and a facelift, or is facelift just one surgery?
I usually separate those because they're the mid face and neck and eyelids. It's a surgery that can take about 3.5 to 4 hours. So if we would do the nose job, it's an extra 2.5, 3 hours. So sometimes it's too much. I tend to separate the nose with the rest of the face. I usually don't combine those two surgeries.
What can you tell us about the scars? Where are the scars? How long? How visible are they?
So for the facelift, we use a scar that goes in the interior part of the ear. We try to place it as far back as possible so it's not that noticeable. And it comes down through the earlobe and then goes into the back and then down the hairline over here. So that way we can stretch the skin from the cheeks, the jawline, and the neck. During the facelift, we also, it's not just pulling the skin, we actually need to pull and reposition the muscle layer that's underneath the skin. So we lift the skin, we reposition the muscle layer, and then adjust the skin over that using those scars, the anterior, posterior ear, and down the hairline.
Is it better to do a facelift at 40 and in the 40s, and does that help for older age, or is it better to wait?
Whenever we start to see that the support mechanisms of the face are starting to get looser, and we call the jowl, and you can see how the jawline is not well defined, the neck starts to get a little bit looser. I think it's better to do the surgery early on rather than waiting too much, because we can do the surgery later on when the skin is really loose and wrinkled. The change is much more drastic when we do it later on. So if we do it earlier, the change is not that drastic, but it's a big improvement, and it does last for about 10 years. So in 10 years, you're gonna look much better than if we didn't do the surgery. So I think doing the surgery early on is better than waiting a longer period of time.
And lastly, what is the recuperation time?
I place stitches in all the scar that I like to take out, usually 6 to 7 days after surgery. And we place stitches underneath the skin here and here. So first 2 weeks, it's very important that we don't do stretching of the neck. We shouldn't be doing this or these type of movements, because we could pull all those stitches. So first 2 weeks, You have to be careful with the movement of the head and the neck. Usually after 4 weeks, big part of the swelling is gone, so you can start doing full range of movements. And exercise, usually after 6 weeks, you can start exercising. So usually first 2 weeks are the most important, and after 4 weeks, you can start doing any kind of activity.